All right, I'm gonna do this sweet extraction bone graft membrane suture of tooth number 19. Root canal tooth fractured off at the gum line. And we've already had profound anesthetic placed. And so we're gonna rock and roll. Start with a little Donatello here, come along the side, just bring it right up to the middle of that papilla there. Okay, come along here, same thing, right up to the middle of that papilla. Work around that PDL just a little bit, don't need a whole lot. And take the Wonder Woman, then we're gonna release full thickness flap. Chin support, please, hands.
Lots of pressure here.
Very nice. Nice envelope flap here. Plenty of space for that membrane to go after. And turn away from me just a little bit there, Don. That's great. Same thing on the lingual. Chin support. Okay. For the goal, if you're watching, is to try to anticipate what is my next step before I do it. Okay. The next step is tuck this little cotton roll back in there. The tongue likes to get all up in the groove here. That's okay. That's okay. Nothing to worry about there. Okay, so next is a handpiece. We're going to section straight down through. There's not much to grab onto here that we would care about grabbing onto, so we're going to section straight down 2/3 to 3/4 down the distance to the root, and just as wide as the tooth. Thank you. Iron Man. Suction. Make sure we're nice and separated there. Give a little stretch. Little stretch. Okay. Now we're going to stretch on this mesial here. Stretch. See if it'll suction. Keep suctioning. If you see red, keep suctioning. I'm actually rotating this way to engage it. There's not much to engage with rotating the typical way. And I'm rotating this way to engage it, and then I'm levering it up. See if it'll slip up for us. Good movement here. Good. You see how that sectioning creates space there, which is what we want. Take our little brad nabber here. I'm basically going to be rocking, slight rotating, kind of flexing it to the facial and lingual. Okay. And there he comes out. Alright, our distal section. Our distal, we're going to flex forward here. I'm going to use my Wonder Woman. little bit of leverage on him. Iron Man. Angle on this one's a little trickier to use, but same thing. Just flexing that, rotating, flexing. Okay. Grab nabber again. Okay. Scoop slide out. Let's get the serrated curette. Some pretty significant granulation tissue down here. So, use the Wonder Woman to get the flap access again. Okay. Suction. Good. Suction straight down there. Good. Great. Continue to work on that. Go ahead. I'm basically just enucleating that all out and get a satisfying little. That's it. Okay, all clear. You feeling there? Granulation tissue's all gone. Good heme in there, which is what we want. Very nice. Okay. And there wasn't anything radiographically on the distal, but always good to double check that. Okay. And just make sure things are nice and clean. Okay. Saline, we're going to irrigate this really well. A little ocean water here. Use the whole syringe, we're not saving it for any later. Okay, then we're going to verify. Usually we got about 10 to 11 millimeters between teeth, so that's right around 11 millimeters now. I'm going to take our prepared minocycline with the contour membrane. That is fairly squared off, isn't it? So that's about 15 that way and about 15 that way. It should be 15 by 20, but it's kind of a shorter guy. Maybe he just curled up real tight. So anyway, at any rate, that's where we're going to trim him off. Right there. Trimming straight across, right at around 11 millimeters here. You're welcome to do an hourglass shape, although I don't personally find that adds a lot of value. You're welcome to do that if you'd like. Okay. Just a little wide still, that's at about 12. We'll turn it back just a little bit more. So that's ready to be placed down in. Use my Iron Man to tuck into the lingual. Just a curly cue for us a little bit. And now we don't want to suction near this unless it's being protected by an instrument. Otherwise it can find itself going down the suction and then we get to grab a new one, which we'd like to avoid if we can. Then we'll just set them back like that. This is our material that we're using, contour matrix, 15 by 20 millimeters, K-Max, blah, 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 by Implant Direct. That's the fancy box there. And then this is the material that we're using is Synergenics Raptos syringe for placing bone graft, which is so great because we've already hydrated it. Now we're going to take off all the excess, squeeze it tight, remove our cap, and then it's ready to go to place. Okay. Suction. I'll hold the suction. Okay. Doesn't need a lot, just a little bit. We can still have plenty of heme in there. Okay, we're going to place this syringe full in here. Molt, and then suction. Okay, suction right on top of that molt right there. Good, and one more time. Good. So the molt kind of holds this guy in place, and then I'm going to use the molt to tamp down our bone graft down into the socket. Switch to a white syringe. It's a little hard to see. We're underneath a coat of heme here, but I'll be able to see before too long. Okay, suction right on top of that molt. Touch it. Yep, suction all around it. Suction all around it. Around the edges. Good. All around the edges. All the red. Good. Keep going. Good. Great. Thank you. Okay, so we can see down in our socket here, we've got great heme. That back, that distal root, don't suction without me in there. Okay, I'm going to place the rest of the bone graft material in now. Okay. Do a little tamp. Okay, you can suction right on top of that guy there. Good, and out. Great. All right. Very good. So now we're going to take our cotton forceps, get the sutures ready to go. Okay. These go just underneath the flap here. Just stretching it just a little bit out of, we over tucked it. It's good to over tuck it because you can always pull it out just a little bit there, which is good. I'm going to do a nice little figure eight. Hey, they got it the right direction the first time. That's great. Okay. Come underneath this front papilla here. Okay, hold that. No suction yet. Okay. Coming over to this inside papilla here. And we're going under and out. That's the easiest way to use the first one. You go out coming in, but this one would go under the flap, and then coming outside the flap. Okay. That guy just jumps through there, didn't he? Okay. He just wants to make it a little more fun. Okay. Suction. Right there on the facial. Yep, good. So we got 1, 2, 3, 4 spaces. So we'll do 1 and 3 on the first stitch. Same thing over here. 1, 2, 3, 4 evenly spaced. We'll do 1 and 3. I'll do this one again because that one jumped through. One, 2, 3 throws. Grab it. And just a gentle 4 out of 10. Snuggle down here. Don't want to do too much. We're not trying to pull in and get primary closure. We're leaving it secondary closure and leaving that keratinized tissue for the eventual implant to be in there. Okay, 1 back and then 1 or 2 forward. We're good to go on that. All right. Now before we do the rest of the stitches here, I'm gonna get the heme out of the way. We've got an initial setup here. Now we're just gonna tidy everything up a little bit. Okay, everything looking lovely.
If that's not clear, then we need to make another one specific for that.
Okay. Got the same thing here. Start at step at position number 4. Hold that. Okay. Coming inside here, position 4 on the lingual. And then because the first stitch was positions 1 and 3, we're going to do positions 4 and 2. And this one, do a little overlap of the figure 8. 1, 2, 3, 4. Here's position 2 right here. About a 3 millimeter in for the bite. I know it looked like Haley slapped that out of my hand, but she didn't. I just let it go. Let it go. Let it go. Here's our position 2, coming back the other way. Three throws across the forward, or 3 forward throws. Okay, and the reason we do 3, I'll tuck this little guy up in our hand here if we can, is it holds it snug. And again, just 3 to 4 out of 10 snugness. 1 reverse throw, cinch it down here. Okay, and I'll do 2 forward throws on this one. Okay, and then leave about 3 millimeters of rabbit ears on that. Okay. And then we'll do a fine little suction down here. Let's tuck that underneath the stitch just a little bit there, but good. Overall, that looks lovely. Now, depending on if there's a lot of heme that's trying to get out, which we don't have that issue, you can put some periacryl across it. You can have the patient bite down on some gauze. I'll probably have her bite down on some gauze here. Open for him just a little bit there, Dawn. Good. And suction. Go to final rinse with slab ejector action. Let's do that.
Put them back down on that. Close your lips down. Beautiful.
Very good. Okay. All right, and that's our final little setup there. Looking good. Put a little cotton in here and go ahead and bite down about 3 out of 10 pressure. Doesn't have to be very strong. Okay, you can take that gauze out in about 10 minutes.